looks at me and she goes, "Gosh, life in a wheelchair must suck for you."
No, she didn't. Okay.
I had to clutch my pearls.
Yes, yes.
You a nurse?
And that's the first thing you say.
The first thing, never met me. And of course, I normally would have just chewed her out, but I had to report her in that situation. I had to stand up for myself in that situation. But that's where we are in 2025.
Yeah,
That nurses, trained nurses, would say something like that to a person. But go ahead.
So, and that's not uncommon. That
Mhm.
is not uncommon. I, at the intersection of being a woman, a black woman with a disability, I've coined a phrase for it. I call it medical profiling. You walk through the door, and they get up and down, and they've already decided what you must be afflicted with. They've already decided what tests they are or are not going to run.
Mhm.
They've already decided how long they're even going to stay with you. And this happens a lot, but you have educated me on a subject about when we don't even have accessible tables
Yep.
and equipment. And so I'm like, wait a minute, I can stand up so I can get in that mammogram, but what happens to somebody who cannot stand on their own 2 feet and uses a chair? What happens to that person?
I can't tell you how much I weigh. My primary care doctor does not have an accessible scale. If I get weighed, I would have to go to the hospital.
Mm-hmm.
If I'm seeing a specialist, my urologist or my neurologist, that would be the only way I could get weighed. Getting, I struggled with because I had 2 children after my injury, so I had to be physically picked up to get on the exam table for my prenatal care and things of that nature. So it was intrusive. My dignity was stripped. There are some doctors, but it's like a needle in a haystack to find
them.
That has, to get a pap smear, I would have to go to the hospital again. So physical access is still
a huge
barrier.
Huge
Mm-hmm.
barrier. But then you're also dealing with the way our doctors and nurses and dentists, and this is something that I do on a regular. I work with crisis assistants to do their poverty simulations. And I come in there sharing my history as a person who's in poverty because I get benefits, but as a black woman with a disability, raising 2 sons with disabilities. And how are we able to navigate this healthcare system? And it's very difficult.